Hello, India was one of the first countries to initiate national program for reproductive health. Back in 1951, we launched the Family Planning Program, which has now evolved into the Reproductive and Child Health Care Program (RCH). क्या आप जानते हैं कि इंडिया दुनिया के पहले देशों में से था उन्होंने ये कदम सबसे पहले उठाया। ये हमारी सोशल अवेयरनेस का एक बड़ा एग्जाम्पल है। The RCH program focused on educating people about reproductive health, offering healthcare facilities, and creating awareness using various platforms like print media, TV, social media, and community approach. It also promotes sex education in school to equip students with accurate knowledge and to dispel myths about sex and protection. ये बहुत जरूरी है कि हमारे युवा गलत धारणाओं में ना पड़े, उन्हें सही जानकारी देना ही सबसे पहला कदम है एक हेल्थी सोसाइटी की तरफ। The key focus of reproductive health is empowering individuals, especially women, to make informed decisions about birth control, safe motherhood, and child care. Other goals including promoting gender equality, reducing maternal and infant mortality rates, and eliminating social evils like female feticide and sexual abuse. और हाँ, सेक्स रिलेटिव अबॉर्शन जैसी समस्याओं से निपटने के लिए सरकार ने एमनियोसेंसिस जैसी टेक्निक्स पर कानूनी रोक लगाई है। With improved living standards and health care, population growth has skyrocketed. India's population rose 1.2 billion in 2011. A high birth rate, reduced death rate, and more people in the reproductive age are major reasons. To manage this campaign like हम दो हमारे were launched, encouraging small families and later even one-child homes. आपने टीवी पर या पोस्टर में देखा होगा एक खुशहाल परिवार जिसमें माँ, पिता और 2 बच्चे हैं। ये सिर्फ एक स्लोगन नहीं, बल्कि एक जिम्मेदार सोच का प्रतीक। Contraceptive methods help in preventing unwanted pregnancy and spacing birth. These are broadly classified as first, natural methods like periodic abstinence, withdrawal, and lactational amelia. Second, barrier methods such as condoms, tampons, and surgical caps. Third, intrauterine devices, IUDs, such as puberty, hormone-releasing devices. Fourth, oral contraceptives, daily pills like saline. Fifth, injectable implants, long-acting and effective. Surgical methods, the last one. Surgical methods, vasectomy for males and tubectomy for females. हर मेथड का अपना एक बेनिफिट है, लेकिन ये याद रखना जरूरी है कि किसी भी कॉन्ट्रासेप्टिव का इस्तेमाल डॉक्टर की सलाह के बिना नहीं करने चाहिए। India is also actively engaged in reproductive research. For example, scientists at CBRI Lucknow developed a non-steroidal oral contraceptive. Take once a week with minimal side effects. ये देश का अपना एक मिशन है जो महिलाओं के लिए एक सेफ और अफोर्डेबल ऑप्शन प्रोवाइड करता है. Thanks to awareness and healthcare first, maternal and infant mortality rates are decreasing. More couples are opting for small families. Postnatal care has improved. Detection and treatment of STDs are more accessible. लेकिन हमें ये भी समझना होगा कि हर एक व्यक्ति की रिप्रोडक्टिव हेल्थ एक सामाजिक जिम्मेदारी है. So let's work towards a future where every individual has access to the knowledge and health care they need to lead a healthy reproductive life. आखिर में एक स्वस्थ समाज तभी बनेगा जब हर व्यक्ति जागरूक होगा, जिम्मेदार होगा और सही फैसला लेगा.